All right, guys, so I just came back from my 1 week follow-up appointment with the Lasik MD Vision in downtown Vancouver. Everything turned out pretty well. Of course, they checked out my cornea flap, if it's healing properly. They noticed that there's no blood clot anymore. The only issue that I'm dealing right now is with the edema of the corneal. Edema of the corneal is swelling of your corneal. So there's fluid there built in. It will eventually subside as the day goes by, but as of right now, there is roughly around 15% of edema in there. So my vision is, when it comes to reading the text or the letters, it is somewhat fuzzy and blurry. I did my vision check again today, and I was able to get my vision roughly around in the 2030 and 2025, but the letters were very fuzzy. I was struggling trying to read them out, but I was still somewhat able to read them out. So he said just give it some time. It will hopefully go away by its own within my next 1 month follow-up. Regarding the anti-inflammation drops, he said to just stop it. No need to continue using it because of the edema is inside the layer of the cornea, not outside. So the drops is pretty much pointless at this time. All I have to do is just use the drops for dryness. So that's all I have to do within probably 4 to 6 times a day. And I just brought this up as well. What if my vision, the clarity of the text and the letters are not there within a year or so? Is there any option that I could make my vision better? Due to my plan, it does comes with a lifetime vision plan, meaning that they can go back and refix the cornea and try to laser off more. They will not cut my cornea because it's already cut, so all they have to do is just numb it up, lift it up, and then cut some more cornea to get that precise thickness what I need to, so that I could see the text more in focus. But other than that, guys, everything is doing great. Right now, I could see pretty much everything. You know, before with glasses and contact lens, I wasn't able to see anything. I was pretty much completely blind. But with this surgery, I could see everything. It's just the text and the writing that's giving me a hard time right now. So for example, if we have a lecture at work, they have a projector on the screen, it might be a struggle for me to read it out. But again, they said, you know, that edema, the swollen cornea, it will eventually subside. So 1 month from now, I'm going to be doing another follow-up, and I'll keep you guys updated. And also one more thing prior to the surgery, I just want to give you guys one tip. Usually prior to the surgery, you will have another assessment to see what vision you have prior to the surgery. The thing you want to make sure is before you leave that room, you want to make sure that you're able to see 20/20 in a crisp, clear vision, not just a blur or hazy, because that is what they will take. The prescription, whatever they will gather the numbers, that is the number that they will be using to give it to the surgeon so that they could use it to deduct of how much cornea they will have to remove. So make sure that you double check before you leave the assessment room prior to the surgery that they have the right number, guys, of your vision prescription. So that is very, very crucial. You need to make sure you double check before you leave that you are satisfied whatever you see when you do your pre-assessment prior to the surgery, and I think you should be good to go. For me, I didn't know that. When I left the room, it was somewhat fuzzy, my 20/20 vision. I didn't know that they were going to base it on that, of my prescription of how much they will remove from the cornea. But anyways, that's just a little, well, not a little, that's a huge tip for you guys if you are going to think about getting a LASIK surgery. Just make sure you double check, guys, because you know our eyes, our vision is very precious, and this is huge if we lose our vision. But anyways, that's just another quick update for you guys. Whoever's following me or whoever's thinking about getting their eyes done, just take notes and just gather all the information that I'm giving you guys from what I'm going through right now. But I'm pretty happy with the result right now. But I'll be more than happy if I will able to see the text more in a sharp image than what I'm seeing right now, somewhat fuzzy. Sometimes I have to squint my eye to get the letters in focus, but eventually the edema, the swollen cornea, will eventually go down, and I'll keep you guys updated on that. And again, guys, if you have any other questions, just let me know. Leave me a comment down below. I usually reply very quick, and that's pretty much it. I'll see you guys within 1 month. Peace.